semua orang. So bersama-sama kita today, with us today we have our pleasure. It is our pleasure to for us to have Prof. Victor. Um, just to inform everyone that Prof. Victor, Prof. Victor adalah our speakers for today untuk tajuk ceramah kita hari ini, Pandemic Proof the Workplace. So basically kita punya pensyarah hari ini adalah daripada Universiti Malaya. Prof. Victor ni sebenarnya kalau kita tengok he is very focused in his occupational health and safety, so sangat spesifik untuk our topik hari ini. Saya lihat Prof. Victor dalam PhD adalah on occupational safety. Prof. Victor sendiri ada 3 masters in English dan in engineering, masters in engineering, public health and juga occupational safety. So it is he's very specific on this topic. Tak ada orang lain lagi yang saya rasa among those yang best would be talking about this topic would be protected. Untuk topik hari ini kita pilih sebab kita dapati ada banyak masalah berkaitan dengan jangkitan COVID di tempat kerja dan kita berharap Prof. Victor boleh bantu kita untuk fahamkan bagaimana kita nak gunakan SOP yang MKN sediakan untuk kita menghadapi COVID di tempat kerja, ataupun adakah SOP itu sendiri tidak cukup, bagaimana sebenarnya. Jadi sebelum kita teruskan benda ini, just nak inform everyone untuk para penonton kita yang berada, yang juga menonton di Facebook Live. Sila perhatikan chat, bahagian chat anda. Kita akan sediakan borang kedatangan dan juga kita akan sediakan beberapa soalan kuis. Di situ nanti mana-mana pemenang yang dapat menjawab soalan itu dengan betul, kita akan sediakan hadiah cabutan betul juga akan. So before kita membuang masa lagi, saya serahkan this talk to Prof. Victor. Teruskan.
Okay, good afternoon everybody and thank you Dr. Saleha for the kind introduction. I'm sorry, basically my focus today is on a pandemic-proof workplace. So I will be focusing on something that is much more current, and we'll be discussing on the ventilation per se. As you know that yesterday itself, the human resource ministry actually have provided us with what we call ventilation guideline. And I'm not going to look at those ventilation guidelines, but I'm going to describe with what ventilation really means and how can we actually prevent a COVID-19 pandemic. And thank you UTM for inviting me, and thank you Occupational Safety Health and Environmental Unit and also everybody in Johor. Okay, and Assalamualaikum. So today we're going to talk about understanding the role of ventilation in the prevention of COVID-19 pandemic. All right. Let us start. Okay, I'm Professor Dr. Victor Hall. I'm from the Department of Social and Palliative Medicine, Faculty of Medicine, University of Malaya. This picture was actually taken early on in 2020, where I went up to the roof to actually look at the ventilation system in one of the hospital, one of our ward. So before I still continue, I like to put on my disclaimer, as Dr. Saleha mentioned that I have a lot of masters, but at the end, I'm not a mechanical engineer. All right. The information that I am going to share in this presentation is based on my experience in occupational safety and health and in managing COVID-19 pandemic in the University of Malaya Medical Center. So if there's any mechanical engineer with a different view, please share with me. I am happy to discuss contradicting view, because we are all from universities, and as a university academic, we are supposed to take criticism. And we basically to have some contradicting views, because that is where we progress. That's how we progress anyway, right? So this is from my point of view, coming from a medical doctor, focused with an engineering degree, engineering masters, and then going on to looking at public health per se, right? I hope it will be much more holistic, much more simpler for you to understand. All right, let us start. Where are we now? Basically, we are talking about SARS-CoV virus, which is basically a novel coronavirus, which we basically discovered in December 2019, where it was first discovered, was found in Wuhan. Of course, how long before that it was present, we also don't know. But the thing that just started in Wuhan, and then it came to Malaysia on the 25th of January 2020. That was more than 1.5 years ago. And to start with, we thought that the virus actually only spread by droplet. But moving on, we know that it becomes aerosolized and it can actually spread by aerosol. And that makes it very much difficult for us to manage it. For droplet, it's quite simple, but for aerosol, it's basically a little bit complicated or complex. But we still can manage, don't worry. And the third thing that we need to understand is 85% of people who actually got the virus are asymptomatic. So that is where we become. So how do we know who is positive and who is negative? So it is important for us to know that currently, because of the high number of people in the community having COVID-19, everybody in the community, we must consider them as COVID-19 positive until basically they have been tested. Even though they have been tested today, tomorrow they can become positive also because it has some incubation period and our testing actually is not perfect. We have seen patients being tested 3 times before we found them to be positive. So we have those information. So don't worry, all right? But today we are not talking about testing. We're talking more about looking at it from the perspective of airborne transmission. So this one was basically in the middle of last year where one person who is COVID positive went for a choir practice, all right? So she went for a choir practice. The choir practice was 2.5 hours long, all right? And then after the choir practice, almost 90% or 94% of the people in the choir practice actually developed COVID-19, all right? So it was to show that if you are basically unprotected, if you're COVID-19 in a closed environment, the chances of you getting COVID-19 is still there. All right. And this is before we're talking about the new variant. All right. We're not talking about Delta variant, we're not talking about Beta variant, not even talking about Alpha variant. We're talking about the original COVID-19. But currently we have Beta variant, Delta variant, Lambda variant, which is basically much more transmissible, much more infective. So we need to understand that. So let us continue with understanding the risk. This is how we perceive it as what we call a droplet infection. And when you cough, basically we produce droplet. And look at this picture, we most probably think that it's just around 1 meter away. But actually, if you look at how far aerosol travels, it can travel up to 7 to 8 meters. All right. So if you are not wearing a mask and you are, let's say, at the other side of the room and someone just cough, the aerosol, if the wind direction is correct, it will reach you. And if the amount of virus is enough, you will basically get infected. So that is important for you to understand. All right. So that's why when we say that we don't encourage you currently to basically take out your mask when you're in public, that is the reason, because we don't want, if you cough, and that is what will happen. I will show you in a later on what happened in one of our in our place here in the hospital. All right. So we can see that talking, breathing, and singing actually produces aerosol, and singing actually produces between more than 1 to 1,000 times more aerosol particles than droplets. All right, singing, that means you're talking loud, like me. We are talking loud, and then basically we have droplet infection. That means even though you don't cough, you just talk to a person, and in a closed environment, droplet infection actually will happen. So those are when you understand the risk in taking into that context, then you know how do we going to prevent from getting COVID-19. So aerosol. Before this, I think last year, 2 years ago, when I am teaching my student, what is aerosol? Aerosol is anything is less than 5 micron. But this has been basically someone last year have brought the suggestion or basically reclassify things that aerosol is anything below 100 micron and it can inhale into respiratory system. So it's a stable suspension, solid and liquid particles, which is less than 100 micron. When we talk about aerosol, definition is less than 5 micron, but currently basically they change to less than 100 micron. And droplet is basically anything more than 100 micron liquid particle exposes what, well, your eyes, nose, mouth, and close range. So droplet is close range, basically less than 1 meter is called droplet. You can get droplet infected. But aerosol can travel up to 7 to 8 meters. Take that into consideration. And of course, now we have new variant coming in. The field is getting much more exciting because we have alpha, beta, gamma, and this is the two. Beta is basically from South Africa, and delta is from India, and both they are more transmissible, and also there is less of vaccine efficacy. That means even though you're vaccinated for 2 doses of basically even Pfizer vaccine, we have seen people 2 doses of Pfizer vaccine. If you're exposed to a person with a high load of virus, especially the beta variant, you can actually get COVID. All right, but just take that and just be careful. Just let me re-emphasize that even if you get COVID, it will be mild disease. You won't need to be hospitalized. You just need to stay at home, just like your normal flu. All right. So the vaccine actually works to prevent you getting severe disease, but it doesn't actually 100% prevent you from getting the disease. All right. So just take that into consideration. Make sure you understand that. All right. Let's look at basic. I think this one everybody knows the basic. All right. Okay. So what are the basic of that we need to understand? Cool air is heavier than hot air. Cool air sinks and hot air rises. Correct. So that is basic, we know. All right. Another thing about air is air move from the high pressure zone to a low pressure zone. All right. So from high pressure to low pressure. So that's where you get wind. Correct. High pressure and a low pressure, there's a difference. When there's a difference in pressure, that's where you generate wind. That's where you feel you feel windy. All right. So that is thing that you need to consider. And the third is when hot air meet with cold air, it basically condensation happen. And when condensation happen, there's water vapor. And water vapor is where we are basically don't like, especially in hospital setting. Because when there's water vapor, that's where you can get fungal infection. All right. I think anybody who's doing built environment will be virtually water vapor is basically one of their headache. How can we prevent fungal formation on the building, fungal formation in the ventilation system? So fungal formation is a problem. So they must make sure that when you get the air into the ventilation system, it must be reduced temperature until that no condensation happen. That's why when people ask to open window, let fresh air in, it cannot be done as what we call just one thing. You got to do it as a system itself. Whether your system actually allow you to open window or not. If you open window, you put in fresh air. Okay, the fresh air is warm, and the air basically meets the cold air. You get condensation. Condensation, what happened? You get fungus. That's the problem. Fungus is a major problem. Fungal infection is more difficult to manage than COVID diseases. Fungal infection, you need to stay in the hospital for 3 months just for the medication because it takes so long for the medication to work. This, I think all of you who are basically in safety and health will understand what is hierarchy of control, elimination, substitution, engineering control, administration control, and PPE. This is what we teach you all. We tell you all, we emphasize. But the problem now is because we are not dealing with something that we created. We're not dealing with a chemical that we introduced. We're not dealing with a physical hazard that we introduced. We're not even dealing with a biological hazard that we introduced. We are dealing with something that we don't want, but it's there. So elimination cannot be there. Substitution cannot be there. So what other tools do you have? You have engineering control. So engineering control, so what can we do in engineering control? Ventilation is good engineering control. We have administrative control. That's what we are doing now. Basically, the SOP, the standard operating procedure, is all administrative control. All right? So you got to wear your face mask. you got to observe physical distancing, you got to ensure hand hygiene. That is administrative control. Of course, PPE is the face mask, all right? So administrative control is there, and SOP is there. Sometimes when we talk about SOP from, let's say, MKN SOP, we need to translate the SOP into what is workable in our environment. I would basically summarize that at the end of my talk. Factors to consider when talk about effective ventilation in the prevention of infection. All right, so ventilation is very good to prevent infection. The only problem is currently because of basically it's not us only, it's the world where they actually make it more efficient to make sure that the use less energy possible to cool an area. When you want to use less energy as possible to cool an area, what is the most important? You try to keep the cold air in the environment as long as possible, so you don't bring in fresh air. Because once you bring in fresh air, you need to cool the air down, and when you need to cool the air down, you need energy. Or you bring in cold air, you need to warm the air down. It needs energy. So when you talk about effective control is the ventilation system, you can look at type of ventilation system, how the air flows within the ventilation system, how much air change per hour is the ventilation system capable of doing when talking about mechanical ventilation system. Can we use high efficiency particulate filter to actually improve or compensate to help us to reduce our exposure to COVID-19? And what is the role of ultraviolet germicidal irradiation, UVGI? Basically, we're talking about this is upper UVGI, and what is upper UVGI, and what is UVGI? That is basically when you basically not for upper. So we will discuss about this. Don't worry, right? Let's look at indoor ventilation system. We have HVAC and we have MVAC. HVAC is heating, ventilation, and air conditioning system. MVAC is mechanical ventilation air conditioning system. Of course, in Malaysia, we don't have the HVAC because we don't use heating. We just look at mechanical ventilation and air conditioning system. So MVAC. So we use MVAC. All right. So everywhere you use MVAC. So when we talk about MVAC, we basically what is the requirement of MVAC? We look at ventilation rate, how much temperature we want to reduce or increase. Basically, we talk about reduce. What's the relative humidity? That means how much humidity we want to keep the air inside the room, and airflow distribution and direction. So we know that relative humidity between 30 and 70% is good, all right, because it reduces the risk of infection. Anything below that is actually bad. Anything above that, 70%, we basically consider it, or I call that a fungal problem. So we need to keep humidity in the range of 30 to 70%, or maybe around 60% is good, all right. So humidity is important, temperature is important, airflow is important. So everything is important. It's not just open the window and then you solve every problem. You want to open the window, switch off the aircon, turn on the fan. That's what you do. Otherwise, don't do it as a simple thing. All right, it's not as simple as it sounds. You know, it is much more difficult. Let's look at central air conditioning system. What is a centralized air conditioning system? A lot of us don't understand what's a centralized air conditioning system. Centralized air conditioning system has a cooling tower, has a cooling coil, has an outdoor damper, has a damper actuator to mixing chamber, exhaust where air actually goes out, have a supplied air diffuser, have a return grill. So all these things are there. So how does it work in a centralized air conditioning system? All right. So outdoor air is basically take in and it's cool in the cooling coil. All right, it goes into cooling coil. After that, when cool air comes down, all right, and then the cool air circulate within the room. All right, it will stay within the room until it become warm. Why? Cold air is heavier than warm air, so cold air stays down until it become warm. Then it goes up, then goes back into the return grill, and there it circulate again. All right. So this is where you have fresh air, because you look at the outdoor air intake, actually it brings in fresh air into the room, and then it basically let it circulate around the room. So this is called cool air. So cool air is heavier and it stays down. So the idea is that even though if you are in a centralized air conditioning system, the risk of infection is still there because the air, cold air actually stays down and doesn't go anywhere. All right, so that is important. Of course, it is important if you look at it from the perspective of a restaurant. Take out your mask. Go inside a restaurant. If any one of them have COVID, everybody have COVID. All right? Because in a restaurant, it's very difficult for us to actually compartmentalize the air flow. We cannot compartmentalize air flow. Air actually flows everywhere, and air flows from high pressure to low pressure. So when there's a high pressure area and there's low pressure area, there's wind. So when there's wind, the air flows. All right. So that is the problem. We cannot do it inside when we take out our mask. We cannot even do it in the office when we want to take out our mask. Correct. So that cannot be done. Just to show you in the centralized air conditioning, that is what is happening. So we need to ensure that when we are in this closed environment, we need to follow the SOP. And the first one is wear face mask all the time. If everybody wear face mask, it will reduce the risk. All right. It's worse even in a split air conditioning system. You know what's a split air conditioning system? The aircon you have in your house, the aircon you have in your office. All right, your split air conditioning system. All right. And where do you have fresh air? You don't have fresh air. The air just circulate within the room all the time. That's why sometimes when we say that we turn on the aircon and go to sleep, in the morning, we basically feel lethargy, tired, because there's less of oxygen, more of carbon dioxide in the air, so we feel tired. If it's the longer we stay in an enclosed room with aircon, the more tired we become because we consume more oxygen and take out carbon dioxide. That's the problem. We cannot generate oxygen in a closed environment unless we have plants and things like that. And the plants don't work in the night. If you put a plant in your house or in your room in the night, actually it consumes oxygen. All right, because photosynthesis only happens at night and in the day when there is sunlight. So you put a plant, I put a plant in the room to help me to pour fresh air. No, the plant actually consumes oxygen in the night. So, all right, the plant also needs oxygen for metabolism. It's the same thing, all right? But only that when the sun is there, the chlorophyll, sunlight, photosynthesis, carbon dioxide is converted into energy, and when that night, when the energy is consumed, oxygen comes out. All right. So plant doesn't help. Okay. Let's look at two systems that we're talking about. Recirculating air system. You can see there's a supply diffuser. All right, and there's a return vent. All right. So this picture actually shows ICU room, intensive care room. All right, in the hospital. All right. This shows that when you have a diffuser and a return at the top, so what happened? The air actually circulates within the room, and even if the patient is inside the room, if your healthcare worker goes in without PPE, the healthcare worker would get basically infected. But we have another system. Okay, this is what it looks like. Remember just now we're talking about diffuser. Supply diffuser, they circulate within the room, and then we have warm air going out. So this is your return vent. Okay. But in the hospital, we also have another system. This is called laminar flow. Laminar flow is where the diffuser is at the top and the return is at the bottom. So the air actually flows from the top to the bottom. So it actually flows like that. But the problem is, because it flows like that, it needs more energy because it needs to cool the air. Your air handling unit, your compressor need to work harder because it need to cool the air more. Because air doesn't stay cool in the room. Air only get cool in the system. So this one use more air. But this is the best system because this one prevent infection. Like what we have in OT, all right? In the operating theater, we even have what we call a HEPA filter here, all right? This is a HEPA filter. This is a HEPA filter, all right? So the air actually comes in here, all right? So the air actually comes in, outdoor air, get cool, go through the HEPA filter, one direction, cool air goes up again. It can basically release it into the atmosphere because we don't want to recirculate the air. And that's how it flows. Of course, there are some pocket of warm air out or warm air that might not go basically, if we don't really remove them, basically they become stale air. So what we need is need a small valve opening up there to actually remove the warm air. So this is the laminar flow. So this is the doctor. They're wearing a mask, surgical mask, and they're attending to the patient. So if the patient is positive or the patient have any other infectious disease, it wouldn't affect the doctor, and you just go one way, all right? And of course, every time you get fresh air because there is HEPA filter. And we have in the hospital, we have what we call negative pressure room, all right? So I think many of you basically don't understand what's negative pressure, what's positive pressure. All right, there is positive pressure room in the hospital. There is basically in your operating theater, your positive pressure room, where the pressure within the room is higher than the pressure outside. So the air in the room is clean. When the air outside the room can be dirty or not clean, it won't come into the room. All right. Remember we talked about pressure just now. Higher the wind move from high pressure to low pressure. All right. So in the negative pressure room, the room is basically the pressure is lower than the outside. So air actually moves from outside to inside. So all the contaminant in the negative pressure room actually stays within the room. It doesn't go anywhere. So in the negative pressure room, basically we talk about negative 5 to 10, all right? The pressure in the gauge, all right? So millimeter of, I think minimum of the mercury, all right? I don't remember correctly, all right? And then basically that is what we make sure to. So there is a negative pressure, there's a gauge here to see there's negative pressure. So this is negative pressure, this will be positive pressure. So this looks into a negative pressure room. So this is how a negative pressure room works. This is your passageway. We have an empty room, where we have a room between the patient room. So the plus sign means to indicate the pressure. So plus in the message is the higher pressure, empty room, lower pressure, patient room, even lower pressure, and the bulb basically is the lowest pressure. So the air actually moves from here, all right, goes down and goes into the patient rooms and go out. So there's a negative pressure. So the air inside the room doesn't come out. So if you have a patient who is COVID positive inside a negative pressure room, the contaminant stays in the negative pressure room. However, we all must understand that the healthcare worker going into the negative pressure room will get infected if they don't wear proper PPE, because the contaminant is in the negative pressure room. It doesn't go anywhere. All right, it's just that it doesn't come out. All right, so it's important for us to understand that. All right, when we talk about airflow, remember earlier we discussed about airflow, how air flows within the room. All right, so this is basically not a scenario, something that really happened. All right, so we have 5 patients. This is one patient here, patient 2, patient 3, patient 4, patient 5. This is patient's bed. All right, this is basically a floor plan of one of the cubicle, and we have basically one table here, where we call nursing table or nursing area, where the doctor actually sits down there and type out all their medical records, all right? Because we use electronic medical record. So after they see the patient, they got to enter all the information in the electronic medical record. All right, this is what is there. So the doctor actually sit there. This patient is actually positive and was coughing. But because we don't know he is positive before he come in, that's why we did not put the patient in isolation room. And what happened is the doctor was sitting here. It was more than 3 meters away. All right. The doctor was wearing a mask, but because the patient is coughing and the volume of virus is so high, and due to how the air flows, the doctor can get it. I'll show you how the air flows. All right. So we have 1 supply. 1 supply, 2 supply, 3 supply, 4 supply, and 5 supply. So the 5 supply when? That means the supply, the air comes in, all right? And then we have 1 return here, where the air goes out. And the doctor is basically sitting below the return. So what happened to the doctor sitting below the return? The air actually is basically would flow there, logically. And to prove my logic, basically we do a computational flow analysis. Ask my friend, engineer, mechanical engineer, all right, to actually help me to actually come up with this computational flow analysis. All right, so this is how it goes. This is your supply, this is your supply, this is your return. Okay, so if you're sitting down there, if the fellow is coughing, the air actually flows there. All right, so the air actually stays in the room. So it actually flows in the room. So you look at all the air particles, that this is all randomly flowing in the room. Correct. and it flows to the return, because that's where the most negative pressure is, the return area. All right. So that is important. You must understand that it's not just what your ventilation is, it's where you close, where you put your supply and return also is important. Sometimes we forget about that, correct? Because why we forget about that? Because we are not looking at that as a criteria. What when we build a system in the hospital, or ventilation system, or MWAP, what is our main criteria? Whether it's cold air, that's all. Comfort, correct. And the third is, of course, your comfort, it comes with your humidity, all right? We forget about how the air flows and where is the higher risk to the lower risk. So let's look at air change per hour. So what's air change per hour? Air change per hour is basically looking at how many air changes you get per hour. 4 air changes, 60, you need around 1 hour to actually clean the room. 6 air changes, you need 46 minutes. 12 air changes, 23, and 20 air changes, 14. So in a normal room, normal office is around 4 to 6 air exchange per hour. In a what we call a OT, operating room, it is up to 20 air exchange per hour. That means for 20 air exchange per hour, every 14 minutes you have fresh air. That's why it's very clean. But we cannot do that in the office. We cannot ask the mechanical engineer to increase the AHU. The AHU cannot handle. The AHU will break down. You consume more energy. See or not? So it cannot do that. You don't think that, oh, let's have some clever idea and increase the ventilation. Cannot. All right. So we have outdoor damper, exhaust, and indoor damper. So the things we can do is we can push the air out. So what do you mean by purging the air? Purging the air is you don't turn on the AHU, don't turn on the aircon. All right, just turn on the fan and bring in fresh air, close the return air damper, and flush out all the air. So this is called purging all the bad air and have fresh air inside. This one you can do it at night after your factory is closed, your office is closed. You can purge every night. You purge the air. So tomorrow morning you come in, you have fresh air. All right. So that is called purging. You can do that purging. You can even purge it 3 or 4 times a day, but that will cost a lot of money. All right. Because once you purge, you got to cool the air down again. Because purge air, basically you use purge air using so that you don't use if you use the purge air and it's cooling, then there's a problem. The other thing you can use is basically look at the filter. All right. This is called upper filter. You basically look at it from MERV, minimal efficiency reported value, and what they recommend is MERV of 13 to able to filter the virus. And also you can use also upper UVGI, ultraviolet germicidal irradiation, basically to irradiate the virus. We cannot use UV for normal room where there's occupant inside, because UV radiation is actually cancerous. It can cause cancer, it can cause cataract. So we cannot use it. We can only use it in an area where there's no people. But you must understand that your upper, when you sanitize air in the upper area, the air still flows inside there. Remember, just like I say, the air actually flows until it becomes hot before it goes back up again. So it's not very helpful for the person in the room, but it's helpful for the next person coming in. This is similar to when you use HEPA filter, all right? When you use portable HEPA filter, it's similar. So split air conditioning unit, all right, as we saw earlier. So if you have split air conditioning unit in a restaurant, it's worse compared to there's no fresh air coming in anyway, all right? In the office also, if you have a lot of people, so it's worse, all right? Even if you have cassette type split air conditioning unit, it's the same thing. But of course, some of the cassette type actually brings in fresh air, but we don't know. All right, most of the cassette type is just that where they place the split unit. All right, same thing happened for restaurant and for office. All right, of course, we remember this picture. I think all of you have seen this picture before. This picture shows that what happened in a restaurant in Guangzhou, in China, sorry. I don't know, and that is what people get infected because of the split air conditioning unit. One of them was positive. The whole place become positive because of how the air flows. As I showed you just now, how air flows within the room. So how do you reduce the risk? Let's say in a clinic you use a split air conditioning unit, because we know that the doctor is supposed to be don't have COVID, and the patient sometimes have COVID. So this is a bad way of basically placing the patient. All right. So this is a better way of placing the patient, because the doctor is behind the patient and the air flows this side, and you can install a little HEPA filter here. The HEPA filter basically will help to clean the air, but it's not 100% effective, because we must understand how the air flows. All right. So what is HEPA filter class that you can use? All right. Minimum is H13. All right, or E13. All right. So H13 is 99.95%, or 99.775%, or 99.995%. So H14 also is good. But it's very difficult for us to get H14, so H13 is good enough. The last thing we are going to discuss about is latrine. Remember, they say that you have to have a water level. All right. Why do you have that? Okay, this is called latrine. This picture is what I teach my undergraduate medical student. We tell them what is latrine. All right. So what happened? All right. So latrine is basically you want to create a seal in a septic tank. So you create a water seal. Water seal basically is a seal so that if without a water seal, if you look at this picture, the virus will basically be able to come out. So there's no water seal. So the virus will be able to come out because there's no water seal. When you have a water seal, the virus doesn't come out. This is not a major problem in Malaysia, because our latrine system, our sewage system, is not connected to our grey water system. That means our toilet is not connected to the water we use in our kitchen. All right, it's not connected. Our latrine water is not connected to the water we use in our bath. All right, it's not connected. But in many countries, these are connected system where the wastewater goes into the latrine, goes into the wastewater system, and it basically goes into your indoor water, and indoor water actually clean the water before actually it put it back into the river. But in Malaysia, we are still not doing it because there is a problem with the indoor water, the oil that we throw inside the what you call that, the kitchen sink. When you put oil in the kitchen sink, it will spoil all the aerobic and anaerobic digestion in the sewage system. So we don't do it. But in many countries, they do that, and that's why they talk about their water seal. So for many countries, water seal is important. But for Malaysia, I don't think it's very important because our sewage system always have water seal. When you talk about water seal, we're talking about water seal for other systems. Like here, water seal for your bath. All right. So this fellow is positive. Basically, the virus is basically volatile or aerosolized, and it can go up to another person. All right. But of course, when you go to toilet, all right, for the next person, make sure that you close the lid, because if you don't close the lid, the virus, when you flush, you generate aerosol, it goes up, and the virus actually goes everywhere. All right. So let us close our discussion. Factors we need to talk about is type of ventilation, airflow, air change per hour, high efficiency HEPA filter, and UVGI. I have explained that, discussed that. Maybe we can ask questions if you want to. So face mask is still effective. If both person wear face mask, you can reduce the basically by 90% of your if both person wear face mask. So it's important for you to understand that face mask is important, and of course with face mask and social distancing. So last thing, even though you are vaccinated, you still have to wash your hand, wear face mask, social distancing, clean the place, avoid crowds, avoid confined spaces, and avoid close conversation. You have to practice this until our number of cases actually come down like per list. All right. If you're like per list, everybody can go to per list, because per list now there's 0 cases. So then we can have much more fun. Thank you very much. I open this one to question. All right. Right. So Is there any question? All right.
Okay. Hi. Thank you, Prof. Okay. Those are very, very technical. I hope all our listeners can gather it, all the information. But okay, there's a few questions. I'm going to give you the first one. This is from J. Muhammad Isfarin. He was asking about if that is the case about the ventilation system. Air filters, like the one or co-way, that do they work or are they just a gimmick for businesses?
All right. Okay. So I'm not going to name brands. Okay. All right.
Okay. Yeah.
Any air filter system. Firstly, you must look at what is the filter. All right. The main thing is the HEPA filter. If it's a HEPA filter, then you ask what's the class of the HEPA filter. As I mentioned, H13. All right. It works not for you to prevent you from getting COVID, because let's say I and you is in the room now. I have HEPA filter, let's say at the side of the room, and I am not wearing mask, you're not wearing mask. If I got COVID, you will get COVID. Doesn't matter HEPA filter, no HEPA filter, doesn't matter how the air flows. All right? Because I'm talking to you at close range, and we are basically both of us you will get COVID because of if I have a COVID. That's important. The HEPA filter actually helps to clean the air so that the next person who comes in will have a cleaner air. All right, so that is important for you to understand. Okay, so it works, but not for not for me and you. If you're in the same room, you're not wearing mask, I'm not wearing mask, I'm talking to you now. Basically, you will get it lah. So that's why the doctor actually got it because of the airflow, and the same thing if I talk to you, also airflow. So HEPA filter doesn't work in that way. It works in a way that it cleans the air. So all your air purifier, the only thing you need to look at is HEPA class H13 and above. That's all. All right. So it must be 99.95% minimum. All right. It's better to have 99.995%. And you're talking about 0.3 micron. All right. So you must understand that it's not. You must look at that from that perspective. All right. But they say the pure HEPA, all those things might not be true. You must look at actually how effective is the documentation. That's why you must read the brochures clearly. Yes, thank you. Taleha? Is there another question, Taleha? Hello?
Okay.
Sorry, there's a delay, is it? Right. Taleha, dengar tak? Hello? Right, I can't hear you. Hello? Hello? UTM, sorry, administration, ada masalah ke tak dengar saya? Hello? Okay, no problem, bye.
hopefully,
boleh. Saya boleh
I'll
jawab.
try to give you the second question, okay?
Alright, no problem.
Okay. Okay. So we have a second question daripada from Encik Firdaus Ferdi. Does that mean that we have to all the developer now they have to make a new layout plan for their building? That is a
Basically,
bit hard.
it's not developer make a new layout plan for their building. Currently, the developer is basically we are developing different system. If you look at the old building, all right, even our old hospital is developed in a way that is for fresh air, all right, is for fresh air to come in. But because a lot of the time we develop buildings, we develop it to have an enclosed area so that we prevent air from outside from coming in. So I think moving forward, the developer and people like that must look at how can we have more fresh air in the system. So it's more of green design. So it's not something new. If you just spend more money to look at green design basically look at more fresh air, more greens, things like that in the environment. So it is not so enclosed. So I think that moving forward that will be good for nature anyway, to reduce the energy use, to reduce you don't have to cool the air so much. Because you understand that if you're outside, there's no issue of you getting the chance of you getting COVID is actually very low compared to having in the inside environment.
Okay, cool. But so far, all our discussion has been about within the building and very specific, like in hospitals and in major building. But how about in schools, or even in public transport? What can they do? Because they are not as technical as hospital or universities. So what do our people can do? The common people can do?
All right, school is very simple. School is go back. I don't know. During your school time, you have aircon or don't have aircon. My school time, all my classes are basically all levers on both sides, windows on both sides, and very open, just a fan. That's a very safe environment.
Okay.
Because you don't use aircon. So once you don't use mechanical ventilation system, MVAC, you don't have a problem. But once you use MVAC, you must use MVAC correctly. For a car, all right, let's say you're in a public transport, if it's possible, open the window. That is one of the most easy way to basically prevent COVID. So if you have fresh air coming in, you open the window. Let's say you are in the car, you've got to look at how the air actually flows. So the simplest way for public is to open the window in the car. Turn off the aircon, open the window.
So that will be applicable for buses as well, isn't it? School buses as well.
If for buses that have closed system, then the buses must install a good HEPA filter system. All right, they have HEPA filter, and they must increase the air exchange. That's very simple. All right. Actually, I have a video that discussed that, and you can see my video on YouTube. Basically, what it says that you see that the C sign that you get, the C sign in your car, all right, the circulation sign in your car, you just got to off it so that fresh air actually comes in. If you get fresh air comes in from the outside, it works. So the aircon in your car actually works something like a centralized air conditioning system, all right? But because we don't have fresh air, we close the fresh air because we want to keep the car very cold. But once you turn on the one that allows fresh air to come in, basically the fresh air will come in and then it will just flow out. So there's an exit at the end of your what we call behind your car or bus, so the air just go out. So fresh air coming from the front, going behind. But the problem with fresh air is that you need to cool the air more. But of course, the environment inside the bus is not so cold. So that things you have to go have to basically sacrifice your comfort a little bit. All right, you cannot have 16 degrees in your car anymore. Maybe 22 degrees or 23 degrees in your car. Right? Anything else, Saleha? Doctor?
Okay. So we have another question from Encik Wan Ismail Muhammad.
Great.
He's referring back to your. We have. So this is referring to you saying that putting plant inside your house is actually not so helpful. So he was asking, does that mean every time you have a plant inside your room, you have to put it outside of the room at the night, or you
No,
do not put it at all?
no, basically it's not there. It's just that people don't think of putting plant in the house to help. All right. Of course, the best thing is to open window only, turn off aircon. That's what I want to say. All right. I want to say is that so that people don't think that okay, because I have a plant in my house and in my aircon room, then at night I will be breathing fresh air from the plant. No, it doesn't. It is not there. So you can actually still put plant in your room because it does provide more fresh air in the morning. But the main thing is you have to open your window at night when you are basically asleep so that you can have fresh air coming in. That's all. It's just that you know a split aircon unit doesn't
Okay,
have fresh air.
logical. Okay, so
Right.
I guess
Yes, please,
I
Saleha.
see. Okay, right. So I guess we have to a final question.
No worries.
So we have a final question. Okay. Final question is this. If that is the case about this, the problem is about stagnant air. The airflow does not go out of the room. It's just stagnant air. In your opinion, when would be the safest place for dining restaurant? Because you have to think about the businesses and people wanted to do dine-in, especially the restaurants. So when
yes, you can
the
have.
best?
There's no safe place within a closed environment. So best is to if you can have dine in outside. All right. Basically, dine in outside is much more dine in outside. That means dine in the restaurant, but in an open area is much more safer. Of course, basically it's very difficult for us to think of it. That you see, when the virus actually when the number of people positive in the community comes down, like what we are having in Perlis, then we are okay. But now in Kuala Lumpur, in other place, I don't think is advisable, all right? Because the number will go up.
Cool. So
Once we reach the state of Perlis, that means everyone basically around less than 10 per day, things like that, then we're not worried. 1 or 2 people get COVID is okay. So we're not here to basically say that everybody should not get COVID. We're not here to basically stop. They say that there should be zero COVID. All right, we have moved beyond that already. We are basically now focused on this is endemic, and what number can be managed? In the sense that if everybody is vaccinated, people will get sick. So the best is get vaccinated as quickly as possible, so that you can return to normal. It's okay, Saleha?
True. Okay, so that's going to talk about that's yes. Okay, so that's mean there's still a long time to go. Yes. That's mean if the underlying factors is we have to get everyone as much as possible to get vaccinated before we can actually sort of return and or face a more possible risk that we can manage, then it's going to take a long time.
Yes, that's why businesses must adapt. All right, especially the F&B businesses, they can adapt and move beyond what they're doing currently, lah. So open area is good. I think if you have open area, then it's much safer. But if you have a closed area, and even whatever system you use, if you see from the diagram, it's very difficult for you to control. And currently, the variant is actually very transmissible, and that is why the problem arises nowadays.
Okay, cool. Right, I guess we are at the end of our session. Thank you very much, Prof. Those are very helpful. Hopefully, everyone else get what we are trying to portray over here about ventilation. It's not, especially when Prof says it's not as easy as opening the window, especially when you are in an enclosed building. So the session will end here. But before we go, we just want to have Dr. Prof to just stay with us for a few more minutes. So after this, we're going to have our session for a little bit of photo takings. But for the rest of you who are listening on Facebook, so we now have our our winner for our quiz. So the announcement is, so the winner for our Grab voucher for $20 or for 20 ringgits is Puan Nur Sabrina binti Muhammad Shuhaimi. So I hope Puan Nur Sabrina Muhammad Shuhaimi is with us, and then you can contact our secretariat to get your vouchers for
Congratulations.
from Grab.
Right. Hopefully you buy some healthy
So
food.
pass on. True.
Yes, stay healthy, especially in
I pass
COVID.
on. True. Yep. So I pass on to Mr. Izwan for the next session on our cabutan bertuah. Prof, we're gonna move on to our photo taking later. Okay.
Thank you.
Alright, Assalamualaikum warahmatullahi wabarakatuh, and very good evening to Prof. Victor Ho. Alright, thank you so much, Prof, for the very interesting knowledge sharing. Thank you, Prof. Thank you, Dr. Saleha. Alright, tuan-tuan dan puan-puan, saya di sini. Apabila saya di sini, tak ada perkara lain. So, kita akan teruskan dengan sesi cabutan bertuah yang terakhir pada hari ini. Okey, pada petang ini kita akan ada satu sesi cabutan bertuah yang terakhir untuk hari ini. Dan untuk pengetahuan tuan-tuan dan puan-puan, kita punya entry untuk cabutan bertuah pada sesi petang ini saya akan ambil daripada link kehadiran sesi ceramah Prof. Victor tadi. Okay, so untuk pengetahuan semua, kita ada lebih kurang sebanyak 277 entry. Okay, 277 entry, dan saya difahamkan di FB Live sekarang kita sedang ditontoni dengan seramai 130 orang. Alright? So tanpa membuang masa tuan-tuan dan puan-puan, kita teruskan dengan sesi cabutan bertuah kita yang pertama. So saya akan memilih 5 orang untuk memenangi cabutan bertuah pada petang ini. Dan kita akan buat sampai habis. Kalau tak habis, kita akan buat juga sampai habis. Dan hopefully kita akan siap putaran kita ini on time lah. So kita mulakan dengan putaran yang pertama. Kita tengok siapakah pemenang cabutan bertuah yang pertama. Nur Atikah binti Ismail. Nur Atikah binti Ismail, sila dropkan komen di ruangan chat FB Live dengan menaip saya ada untuk melainkan diri anda memenangi voucher Grab bernilai RM20. Nur Atikah binti Ismail. So saya akan call up nama sebanyak 5 kali saja. Nur Atikah 1, Nur Atikah 2, Nur Atikah 3, Nur Atikah 4, Nur Atikah 5. Ada ke Nur Atikah? Sekejap Nur Atikah. Nur Atikah tak ada. Nur Atikah tak ada. Okey, tak ada. So kita teruskan dengan putaran seterusnya. Kita ada 5 cabutan bertuah pada sesi petang ini tuan-tuan dan puan-puan. Muizuddin bin Muhammad. Muizuddin bin Muhammad. Sila munculkan diri anda di ruangan chat FB dengan menaip saya ada untuk melainkan diri anda memenangi voucher Grab bernilai RM20. Muizuddin bin Muhammad. Muizuddin 1. Muizuddin 2. Muizuddin 3. Muizuddin 4. Ada. Muizzuddin Muhammad ada. Ada tanya Encik Muizzuddin, sila screenshot paparan di FB Live dan WhatsApp saya di talian 0133990108. Okey. So kita dah ada seorang pemenang bagi cabutan bertuah. So kita ada lagi 4 slot. Okey, kita putar lagi. Kita tengok siapakah yang memenangi cabutan yang kedua. Nur Hidayah Matno. Nur Hidayah Matno, sila munculkan diri anda di ruangan komen FB Live dengan menaip saya ada. Nur Hidayah Matno. Nur Hidayah Matno, sila munculkan diri anda di ruangan chat FB Live dengan type saya ada. Nur Hidayah 1. Ada. Nur Hidayah Matno ada. Alhamdulillah. So kita ada 2 pemenang. Kita dah cabut 2. So kita tinggal lagi 3 cabutan bertuah untuk dimenangi pada sesi petang ini. So saya putar. Nur Hidayah Matno tadi tolong screenshot WhatsApp saya 0133990108. Okey, tanya kepada Fong Li Yi. Fong Li Yi. Fong Li Yi, sila munculkan diri anda di ruangan chat FB dengan menaip saya ada untuk melayakkan diri anda memenangi voucher Grab bernilai RM20. Fong Li Yi. Fong Li Yi 1. Fong Li Yi 2. Fong Li Yi 3. Fong Li Yi 4. Fong Li Yi 5. Tak ada tuan-tuan dan puan-puan. Tak ada. Fong Li Yi tak ada Tak ada. Kita tunggu satu. Saya kira sampai 5. 1, 2, 3, 4, 5. Tak ada. Fong Li Yi tak ada. So kita remove Fong Li Yi daripada entry dan kita putar lagi sekali tuan-tuan dan puan-puan untuk pemenang cabutan bertuah yang ketiga. Saya Hashim. Alright. So tuan-tuan dan puan-puan, Siti Zalita binti Abdul Talib. Tanya Kak Siti Zalita. Sila munculkan diri anda di ruangan chat FB dengan menaip saya ada. Saya kenal ni kakak semasa saya di UPMU dulu ni, Zalita Kak Siti Zalita, sila munculkan diri anda di ruangan chat FB dengan menaip saya ada untuk melayakkan diri anda memenangi voucher Grab bernilai RM20. Ada. Alhamdulillah. Okey tuan-tuan dan puan-puan, kita lagi 2 cabutan bertuah. Kak Siti tolong screenshot paparan di FB Live dan WhatsApp saya di talian 0133990108. Alright? So kita ada tinggal lagi 2 cabutan bertuah tuan-tuan dan puan-puan. So saya remove Siti Zalita daripada entry dan saya putar untuk putaran kedua terakhir di sesi petang ini. Tuan-tuan dan puan-puan, sama-sama kita lihat siapakah yang bertuah. Chun Kok Wai. Chun Kok Wai. Sila munculkan diri anda di ruangan chat FB dengan menaip saya ada. Saya ada. Chun Kok Wai. Type saya ada di ruangan chat FB untuk melayakkan diri anda memenangi voucher Grab bernilai RM20. Rakan-rakan yang lain boleh panggil lagi kawan-kawan mana yang keluar ada urusan rasmi ataupun ada kerja lain, panggil balik untuk join kita punya FB Live supaya semua ada peluang untuk memenangi cabutan bertuah. Chun Kok Wai 1. Chun Kok Wai 2. Chun Kok Wai 3. Chun Kok Wai 4. Chun Kok Wai 5. Tak ada. Chun Kok Wai tak ada. So kita remove Chun Kok Wai daripada entry. Kita putar lagi untuk kita mencari siapakah 2 peserta bertuah lagi bagi sesi petang ini. Sama-sama kita lihat siapakah yang bertuah. Saiful Bahri Abdul Rahman. Cik Saiful Bahri Abdul Rahman. Tahniah kepada anda kerana anda baru saja memenangi voucher Grab bernilai RM20. Tetapi sebelum itu, sila type saya ada di ruangan chat FB Live untuk melayakkan diri anda menebus voucher tersebut. Saiful Bahri, sila munculkan diri anda di ruangan chat FB Live dengan menaik saya ada. Saiful Bahri 1. Saiful Bahri 2. Saiful Bahri 3. Saiful Bahri 4. Saiful Bahri 5. Tak ada. Encik Saiful Bahri tak ada So tak ada, kita remove Encik Saiful Bahri. Confirm tak ada, okay, alright. So kita putar lagi. Dua lagi cabutan bertuah ya, tuan-tuan dan puan-puan. Dua lagi cabutan, siapakah yang bertuah? Saidatul Akmal binti Muhammad Rashdi. Tak silap saya, dia dah pernah menang ni semalam ni. Saidatul Akmal binti Muhammad Rashdi. Tahniah kepada anda. Sila munculkan diri anda di dalam ruangan chat FB dengan menaip saya ada. Saidatul Akmal. Sila munculkan diri anda di ruangan chat FB dengan menaip saya ada untuk melayakkan diri anda memenangi voucher Grab bernilai RM20. Dan silap saya Datuk Akmal ni semalam dia dah menang voucher RM20. So kalau betul dia ada dalam FB Live ni, so maknanya dia dah menang RM40. RM40 kenyang tu makan kalau dia melalui Grab. Saya Datuk Akmal 1. Saya Datuk Akmal 2. Saidatul Akmal 3. Ada ke tak ada ni Saidatul Akmal ni? Saidatul Akmal 4. Saidatul Akmal 5. Tak ada. Saya cek balik atas, tak ada. Confirm tak ada Tak ada Saidatul Akmal. Okey, bukan rezeki dia lah. Tak apalah, rezeki dia semalam dia dah dapat RM20. So kita remove Saidatul Akmal daripada entry. Muhammad Amin Derani, nama tak naik bro. Sabar, tunggu. Kita tengok siapa yang naik lepas ni. Alright, kita tengok siapakah yang bertuah. Azlin binti Tajudin. Azli binti Tajudin. Azlin bukan Azli. Azli itu nama lelaki. Azlin binti Tajudin. Sila munculkan diri anda di ruangan chat FB dengan menaip saya ada untuk melayakkan diri anda memenangi voucher Grab bernilai RM20. Ada Lin Tajudin, ada. Alhamdulillah, Lin Tajudin. Nama FB dia Lin Tajudin. Nama betul dia Azlin. Nama glamour Lin. Alright. So tahniah kepada Azlin binti Tajudin. Sila screenshot paparan di FB Live dan WhatsApp saya di talian 0133990108. Alright tuan-tuan dan puan-puan. Tinggal satu saja pemenang cabutan bertuah yang saya akan cari pada petang ini. Siapakah yang bertuah itu? Satu saja pemenang cabutan bertuah lagi yang tinggal. Satu slot sahaja lagi yang tinggal. So mari kita sama-sama nantikan. Lebaran makin terasa tuan-tuan dan puan-puan. Siapakah peserta yang bertuah ini? Sama-sama kita nantikan siapakah pemenangnya. Joharin bin Surif. Cik Joharin bin Surif. Sila munculkan diri anda di ruangan komen dengan menaip saya ada jika anda ingin memenangi voucher Grab bernilai RM20. Cik Joharin bin Surif. Sila munculkan diri anda di ruangan chat FB dengan menaip saya ada. Joharin 1. Joharin 2. Joharin 3, Joharin 4, Joharin 5. Tak ada. Tak ada. Encik Joharin tak ada. Okey, so kita masih ada lagi satu slot. Okey, so saya remove Encik Joharin daripada entry. Kita putar lagi. Putar lagi untuk kita mendapatkan cabutan bertuah yang terakhir. Mari tuan-tuan dan puan-puan kita lihat siapakah yang bertuah. Muhammad Hanis bin Aziz. Muhammad Hanis bin Aziz. Hairil Anwar, kita putau lagi. Ya, putau. Muhammad Hanis bin Aziz. Sila munculkan diri anda di ruangan chat FB dengan menaip saya ada untuk melayakkan diri anda memenangi voucher Grab bernilai RM20. Muhammad Hanis bin Aziz. Avanto Seaziz. Ini kawan saya masa redaksi dulu ni. Muhammad Hanis bin Aziz. Tahniah kepada anda Muhammad Hanis. So sila screenshot paparan di FB Live dan WhatsApp saya di talian 013-399-0108. Baik tuan-tuan dan puan-puan, tahniah kepada semua pemenang cabutan bertuah. Okey, tahniah kepada semua pemenang cabutan bertuah dan terima kasih kepada tuan-tuan dan puan-puan yang setia bersama kami. Okey, dalam menjayakan sesi ceramah pada petang ini dan sedikit pengumuman kepada tuan-tuan dan puan-puan pada esok hari pada 7.45 pagi teruskan kekal bersama kami sebab esok pagi kita ada senaman ringan pada pukul 7.45 pagi dan seterusnya kita akan teruskan aktiviti Fiesta kita. Besok merupakan hari kemuncak, hari kemuncak Fiesta di mana besok merupakan hari perasmian Minggu KKP. Okey, insyaAllah oleh IR Muhammad Rosdi, pengarah JKKP Negeri Johor yang akan merasmikan Minggu KKP peringkat Negeri Johor. Jadi tuan-tuan dan puan-puan, saya minta untuk bersama-sama dengan kami pada esok hari untuk kita memeriahkan lagi majlis kemuncak kita pada esok hari. Panggil semua kawan-kawan, kakak-kakak, abang-abang, adik-adik, isteri lah kan. Kalau ada lebih satu isteri tu panggil semua. Okey, anak-anak untuk semua sama-sama kita menyaksikan hari kemuncak Fiesta kita pada esok hari. So tuan-tuan dan puan-puan, sebelum saya tamatkan sesi ini, saya ingin share satu video teaser. Okey, untuk pengetahuan tuan-tuan dan puan-puan juga, pada esok hari akan berlangsung juga pelbagai aktiviti-aktiviti yang menarik seperti pertandingan kuis. Okey, kita ada cabutan bertuah juga tetapi tidak diuruskan oleh saya lah. So cabutan bertuah itu akan diuruskan sepenuhnya oleh pihak DOSH. So banyak lagi aktiviti-aktiviti menarik. So besok bersama-sama dengan kami untuk kita memberiakan majlis dan terdapat juga perkara-perkara penting yang berlaku esok tuan-tuan dan puan-puan seperti kita akan menyerahkan polisi KKP UTM kepada pihak DOSH sebagai tanda menunjukkan tanda komitmen UTM dalam menjaga dan menjadikan aspek KKP ini sebagai salah satu daripada agenda universiti. Alright. Selain itu juga tuan-tuan dan puan-puan, esok juga ada pengumuman pertandingan video pendek KKP 2020. Fiesta yang pertama tahun lepas kita ada buat satu pertandingan video pendek KKP. So kali ini kita akan umumkan pemenangnya siapa dan hadiah yang menariknya di sini adalah hadiah yang bernilai RM1,000 tuan-tuan dan puan-puan. Hadiah yang bernilai RM1,000. Siapakah yang bertuah akan memenangi hadiah bernilai RM1,000 itu? Jadi tuan-tuan dan puan-puan, kita sama-sama lihat teaser video. Saya share dulu. Sama-sama kita lihat video teaser. pertandingan video pendek KKP. Yes. Yeah. So okey. Tuan-tuan dan puan-puan, teruskan kekal bersama kami. Tadi itu adalah video teaser untuk pertandingan video pendek esok hari. So sama-samalah kita memeriahkan majlis pada esok hari, dan saya dengan ini saya ingin menutup majlis ini dengan serangkap pantun spontan. Alright, budak-budak membawa tuala ingin mandi di paya. Segala yang baik itu datang daripada Allah Subhanahu Wa Taala, dan segala yang buruk itu datang daripada saya. Alright, so saya memohon maaf di atas segala kesilapan teknikal sepanjang berlangsungnya sesi cabutan bertuah ini. So kita jumpa besok ya tuan-tuan dan puan-puan. Assalamualaikum warahmatullahi wabarakatuh.